We'll move now to Prof. Gonca, who will talk about, during COVID, trying to change learning methodology for her students, and this is in Turkey. Prof. Gonca, would you like to start?
Yes, thank you, Professor Fortune and Professor Alam. I'm very glad to be here today. Thank you so much. During the next 15 minutes, I will be talking about the advantages and disadvantages of distance learning in dentistry. As you know, COVID-19 pandemic has affected every part of our lives. In addition to economic and social impacts, educational activities are poorly affected due to quarantine and social isolation policies. Specifically, dental schools faced changes in traditional dental education regarding preclinical and clinical training and theoretical courses. If we think why dental education has been affected so much, the reason is that the production of aerosol and cross-infection risks are quite high in dental practice. At the early stage of the pandemic, emergency cases are only treated in dental practice. Therefore, preclinical training and theoretical courses are rapidly converted to distance learning for the limitation of the elimination of the spread of these viruses among students, lecturers, and patients. If we consider the importance of students' feedback at this point, they are critical sources for us to evaluate the effectiveness of dental education during the pandemic and to give clues for future blended education. Therefore, the aim of this study was to assess the advantages and disadvantages of distance learning in dental education during the pandemic. And there is a problem. Yes. In this cross-sectional study, 608 students participated. As it is seen on the table, over the half of them were female and were in preclinical training. That is the fundamental part of the dental education and to get good clinical skills. Data were collected through the use of an online questionnaire related to advantages and disadvantages. Open-ended questions were asked and students gave 3 responses for potential advantages and disadvantages. Then, the prominent responses were also presented according to academic years of the students. Online data were collected in January 2021. During this process, clinical experience was 6 months in 4th-year students and 19 months in 5th-year students. When this study was performed, clinical training only continued for 5th-year students in the dental school. Other students were in the preclinical training. As you see on the figure, reassessing to course at the desired time, being able to attend courses at home or in any environment, and easy access to course materials were identified as key advantages. Limitation of time spent during transportation and saving times were other advantages. From the perspective of dental students, lack of preclinical and clinical training, technical problems, inability to focus on the lesson, no interaction with courses, lack of socialization, and learning difficulties were disadvantages. In addition, decrease in motivation, relaxation in home environment, difficulty in time management, negative health consequences, staying away from the school environment, irregular course hours, and distraction from professional skills were considered as disadvantages. As you seen on the figure, blue columns shows reassessing the course at the desired time, and green ones show being able to course at home or in any environment as the most important advantages. Having flexibility to assess courses anywhere was the main advantage, especially fifth-year students. As you predict, students feel anxiety about their professional improvement. Reassessing the course could help them to understand more. Practical training without teaching preclinical or clinical activities was the most frequently expressed disadvantage for all groups except fifth-year students because they are in the clinic in this period. However, it's interesting that inability to focus on was the prominent disadvantage for this student group, especially fifth-year students. As it is summarized on the diagram, distance learning has advantages, some advantages and disadvantages. As you know, preclinical and clinical skills are crucial components of students' professional improvement. Face-to-face learning is preferred by undergraduate dental students because communication is quite difficult among students and lecturers. The other interesting point is that the pandemic as a crisis also stimulates to ensure new technologies such as simulation-based training, haptic system, and virtual reality in dental education. Our results provide helpful clues in the development of future blended learning in dentistry. But the main limitation was that the study was performed in a single dental school. Now, face-to-face training and distance learning are both being provided by dental schools. Therefore, further studies should focus on the outcomes of blended education in dentistry. Finally, even though distance learning provided more accessible courses to dental students, developing professional competence appeared to be a fundamental issue to consider with distance learning.
Great.
And thank you. Best wishes from Istanbul, Turkey.
Okay. Thank you very, very much, Gonca. And I'm sure there's going to be lots of questions about this. And they will also be looking at generalizability. And I think because we are a global audience, how we could work together, not only in dentistry, over medicine, these patient-facing courses.
So please remember, if we all help and do a little bit, it will make a big difference.